on the Instagram, but as it was a delay for 10 minutes, I'll start on Instagram. Sorry for the delay because of the OPD. I could just finish the OPD, that's why. So let's welcome the Dr. Kanwar. Good afternoon. I think she's Dr. Navjot, I think, no? You had to discuss one case of of a dog, of lymphoma. You could send the whole symptoms and then maybe I'll answer that question. So I hope I've started an organon series. If you have seen my YouTube videos organon, so make sure that you also hear that organon series so that you understand which aphorisms and what Hahnemann has told about the approach and the philosophy of homeopathy, because organon is the basis of that. We'll start again on Instagram live also. We are live on Instagram also. Just a minute. Sorry for the delay again. So let us start with other question answer sessions, and I hope you have your questions ready. Respiration difficulty eating after amelioration stools. Sometimes what happens that we get so interesting symptoms, and we sometimes fail to get this rubric, and we feel that every symptom has a rubric. But remember one thing, if you're prescribing only on one symptom, sometimes what happens that symptom of the patient would be relieved, and then again other symptom starts of the patient. Again modality changes. For example, I had told you something about migraine, where the patient says that I am during migraine, I have habit of eating a lot of food, and we take that rubric, it is better. And the patient comes and says, whenever I eat salad, there is migraine, we give medicines, it is better. The modalities will keep on changing. So of course I'll tell you the remedies for that, but make sure that automatically you start getting that whole case. That's important for us. So whenever the patient says that he's better after stools, think of your remedies. First is natrum sulph, second is rustox, third is phosphoric acid, and you must think about pothos also. Yeah, Rui, good afternoon. Meera, good afternoon. Navjot, good afternoon. Madhav, good afternoon. Madhu Sports. Okay. Yeah, Dr. Navjot, you have the case of lymphoma. Either you can share it now or you can share it on my WhatsApp and I'll get you the remedy. So that's what I was telling you. So I was just also telling you some. Hello, Dr. Babel, and I hope Dr. Babel you will decide fast and get the dates right so that you can come and visit my clinic. Okay. Next, I hope Dr. Redensnovog, I hope you understood that as emulated by stools, because again I would tell you, I have given you the remedies, but then if you feel that you need some more remedies exactly related to stools, then you have to again search Matramedic and all. But I would still suggest that after 2.5 years of our YouTube life, you must understand one thing, that now it is very important to understand to get the whole case, the whole case right, so that you are able to interpret symptoms in general and prescribe on the constitution, that will give you cure. And that's why if you have seen my looking to flights, okay, Dr. Babel, I hope you do it early, Good afternoon, Dr. Uppal, Dr. John C, welcome. And stools amelioration also, you can always think about one remedy. Dr. Who has asked the question? Yeah, one remedy also which is very, very, I have prescribed and it has also given me very good result. That is Sympholycarpus fetidis. That is also an important remedy where the patient says that asthma is better by stools. It's a rare remedy. I have used rarely also. It's from the plant kingdom. It is Sympholycarpus fetidis, and it is also called as, I think, Ictodis fetidis. Ictodes. Okay. Yeah. Good noon. Looking for the flights. Yes. Send a request to you all. Just missed a question on Instagram. Left-sided kidney stone of 6.5 millimeter, no symptom present, just found on the USG approach and guidance. Yeah, sometime what happens that we have kidney stones or we have gallstones, and we are doing ultrasound for something else, and we come to know that we have gallstones or stones. So don't take that rubric. Every time you don't get the symptom and the body is trying to only by investigation we come to know, don't take always the rubric secretive. There are lots and lots of doctors who come, sir, take the rubric secretive. This is not secretive. You did not know because or you can say the constitution was very strong. No, go to the case that there is a problem in the calcium metabolism. Make sure that you take the whole case and the stone will definitely get cured. Whole case is important. Don't take the rubric secretive. Don't take the patient is very strong-willed and all. You'll sometimes hit or sometimes miss the case. But in this case, if you found out, go to your case taking, do the case taking, and you'll get the remedy right. Medicines for a topo positive, any specific? If you could answer, if you could elaborate on your question, Dr. Johnson, I would be able to answer it better. Okay. And I hope now, last Saturday, I told you that we are taking that Zoom lecture series, November lecture series. I'm starting again after maybe 1 year or 1.5 year lecture series. So I hope everybody knows we are starting from 2nd of November every Thursday, 1 hour, 3 to 4 in the afternoon. There I'll be discussing cases, how do I repetize and how do I come to the remedy, and something about organon, so that we have a complete package. It's basically for the first time I'm doing after 1.5 years. So let's see how does it go. But I hope you can join and take some inputs for your practice, because rubrication and taking the case is a very, very important part in homeopathy. I'll be discussing my 25 years of experience in my practice and how many results I've got, and I'll show you the cured cases in my that November series. So I hope you join, and flyers are with you, and make sure that you join so that the seats are limited. Difficulty in swallowing, only saliva and liquid and solids are okay. See, if you have this type of symptom, difficulty in swallowing saliva, you could take liquids, because there is hardly any symptom, any rubric where I have seen this the patient has difficulty in swallowing saliva. Only in cases of throat disorders where there is pain in deglutition and the patient has to swallow and saliva is painful. That's okay. If that is there, then there are lots of remedies. But when you're telling that throat pain is there and difficulty in swallowing saliva, you can have lot of remedies for that. For example, pain general where salivation aggravation. There is a very, very rare remedy which I have used in my practice, that is beryllium. If you see, on saliva is more difficult to swallow than food, then there is laccan. Okay, and sometimes the saliva, when you swallow saliva and the pain is so severe, in books it is written it is ulcerative pain when swallowing the saliva, and the remedy becomes Muxol. And one or two remedies which you must think about, where swallowing saliva is difficult. Of course, lachesis comes very important. And there is one rubric, if I am not mistaken, in the repertory, it is written swallowing saliva is almost impossible. Is almost impossible. And that remedy, if I am not mistaken, it is lizard. Lizard, the name of the remedy, I think amphisbena, AMPHISBENA. And the other remedy which is very common, and it is written that saliva is impossible to swallow, then the remedy is pink root, that is spigelia. So if the symptom is very, very pronounced, you take this. Otherwise, I would still prefer to go into the whole case and prescribing. Dr. Johnsy, you can write down those remedies. Okay. Welcome, Dr. Mende. Thyroid peroxidase antibody positive. Yeah. So we always when we have a case of hypothyroidism and the thyroid comes to normal, we have stopped all allopathy medicine, then we do anti-TPO, that is thyroid peroxidase enzyme, and then that is enzyme which is very important in thyroid metabolism, and that's why we do that test. And that test, if it comes to normal, that means it is a complete cure. Just in case of diabetes, where we find that the pre-meal and the post-meal sugar are normal, but we do HbA1c to understand whether that is normal. So it is the same as anti-TPO. That is important to understand that the patient is cured or not. Okay. I hope Dr. Johnsy, you understood and you wrote down the remedies for that. Okay. I hope you get that. I have sent my mother's report on WhatsApp. This is now 13 after 1 month of your medicine. Okay, I'll just see the case, and next month the TSH, when it starts coming to normal, we'll start tapering off from 100, we'll do 88, then 72.5, then 60. We'll start tapering the dose of thyroid, and gradually she'll come to normal. Okay, so Dr. Johnsy, it's a very interesting question, and if you have a classical case, like that, you prescribe the remedies, and let's see in the next YouTube or Instagram live, you write down your results, and we'll see whether it has worked or not. Okay. Thank you so much. No, ulcerative pain, that just crossed my mind, because there are a lot of patients now of upper respiratory infection, throat infection. The patient is, doctor sir, whenever I swallow saliva, it is so painful. और पेशेंट बोलता है हिंदी में, ऐसा लगता है कि मुझे कुछ जख्म हो गया है, जख्म, wound type feeling, and that is exactly the symptom of mercury. Yeah, welcome Dr. Palak. I hope everybody has got that flyer of that November webinar which I am taking, live webinar, live case discussion we are taking, the whole series of Thursday, because last time when I asked, everybody told me that we have not got. So I have told my doctors who are working with me to send the flyers to everybody, so that everybody knows that the class is going on. Otherwise, there were a few doctors who told that to take the class and they did not know that the class was going on. So we are taking on next month every Thursday, and make a note of it, and if you can join, it will be nice. It is 3 to 4 in the afternoon. Dr. Homeo Shine, welcome. Oh, yeah, okay. Dr. Navjot. Yes, so if you don't have any questions, can we go further? Yeah, so there was a question on WhatsApp, secretive. Now, everybody wants to know, secretive is not that just we don't get the symptoms from the patient, it becomes secretive. It has to be very much pronounced, that rubric. Okay, Dr. Navjot, you discuss the case of your dog, and we'll see the medicine. So I was talking about secretive. Everybody has a fancy of taking secretive whenever the disease comes. We don't know, and we get the disease, but that rubric, whenever you take a primary rubric to understand the case, that secretive personality or that rubric has to define the whole personality. Then you can take that rubric. Otherwise, what will happen? You can take if you take a case of 2 hours, you can take a rubric from every symptom of the patient. You can get 8 to 10 rubrics, and the remedy is all polychrist. So try to take rubric. If you are taking a rubric, try to take that primary rubric which is summarized in the whole case. That should be in the whole patient's personality. That should define the whole patient's personality. So that entry point of your rubric is very important. You take 10 rubrics, 12 rubrics, 15 rubrics, not important. You take only that rubric which defines the whole personality of the patient. If you have seen my practice, I only enter from 1 or 2 rubrics. You can ask my assistant doctors who are working with me, 1 or 2 rubrics, and then you enter the case, and then you can confirm the remedy which comes on the repertory chart. Repertory is very important. Does Spongia Q work in skin cases? Well, I have never given Spongia Q for any skin cases, but it is a medicine, it has to work. So if you are feeling that Spongia Q you should give, so give in potency first, in low potency, rather than giving in mother tincture. I don't know whether mother tincture works or not, but you can give in low potency and then see it works or not. Okay. But to understand Spongia remedy, I have lots of time discussed in my webinars. Make sure that you use that symptom for your prescription, because by using that symptom which I have told in my webinars, I have never failed. So make sure that you study a Spongia mind properly. I have discussed a lot of times in my webinars, and I hope the medicine works. But mother tincture, you can use low potencies. That would work. Yeah. So I was telling something about rubrics. One thing also, whenever you're taking a case of, there are a lot of cases where the patient comes to us with cough, cold, coryza, and lot of hoarseness. मतलब गला जाम, मतलब गले से आवाज बराबर नहीं आ रही है, वॉइस हॉर्स हो गया है. आपने देखा होगा पिछली बार भी, लास्ट टाइम ऑल्सो माई वॉइस वॉज very hoarse. I could not speak properly. Now it is better. So whenever you are taking a case where you have hoarseness of voice, you have to differentiate two things. One is whether it is painful or whether it is painless. And by having these two symptoms, you can automatically differentiate remedies. Then you can go in deep and then prescribe the remedy. Why is the hoarseness? How is the hoarseness? Is it because of overuse? It is painful. It is painless. And then you can prescribe the remedies. Don't always try to go to that symptom of taking the case and all. Sometimes local symptom, as Hahnemann says, in acute disease, the symptoms are very fresh in the patient's mind, and the patient remembers every symptom very distinctly. So you can use that information from the patient because he knows all the symptoms, so it becomes easy for prescription. But the problem starts where you have to understand what symptoms you have to ask and when to prescribe. That's important. Okay. Rapid welcome, Nagi. Yeah, thank you for that 100%, so that I can know that everybody is understanding. Okay. Sir, as I know, homeopathy does not act against nature, but is there any specific remedy for abortion in initial month or the first trimester? A very, very interesting question, Dr. Paul. A very interesting question. Well, I have never given remedy homeopathy medicines for abortion, but I have seen a lot of doctors when I was working with some doctors. So they used to give. There are 3-4 remedies which are very, very important. You can write down and try, and maybe you can share the result next time. The remedy is sickle core, viburnopulus, pulsatilla, gossypium. So these are the 4 remedies. Some symptoms you can match, and these are the remedies which would help you to. Actually, it does not do it, but these are the remedies which I have seen doctors use, and sometimes they get good results. The only problem, Dr. Paul, is that when you get bleeding, sometimes it is only half bleeding, half stays behind. That means it sticks to the endometrium, and the whole. It is not possible. The whole that blood clot does not come out, and then that's a problem. Even the patient has to go for a DNC because that will cause difficult menses and offensiveness of discharge, and then we come to know that half has come out and half has not come out. So make sure that does not happen. Okay. But why to do abortion? Ask the patient to go to a gynecologist. Thank you for my son is better. First 1-2 doses, maybe due to full moon effect is he's coughing today. Also, we are planning to go for yesterday. Yeah, X-ray. Yes, Dr. Mira. Don't go for the X-ray now, because if it is a full moon phase, wait for 2 or 3 days, then go for the X-ray. Okay, don't go for the X-ray now. Wait for some time, because the moon phase requires 2 days at least to go. Yeah, Care Clinic, welcome. Dr. Gaikwad, welcome. Dr. Paul. Okay, I hope you understood. And I have not got any thumbs up for that November webinar, that everybody has got that information. It is very important you get the information. After this, a lot of doctors come and tell me that, sir, we did not know, and that's why we could not join. So please send the recording and all. So recording I can send, but live one-to-one discussion would be definitely better than the recording. So I hope if you have got that flyer, give me a thumbs up so that I know that everybody has got the information. Okay. Walaikum Assalam, Dr. Almagir. I have a case on WhatsApp. Just a minute. Good afternoon, sir. A patient, 35 years, chronic tinea corporis, tomato, mind, emotional suppression, business failure, anger, suppression, responsible. So I gave a staph to upgrade, but no change. Yeah, so homeo shine. The problem starts, when we get tinea infection or viral infection, it is always because of low immunity. That's what the virus or the COVID comes to in the body. Make sure to understand where did the immunity of the patient go low. Because this symptom can be given by all the doctors that we have a problem, that tinea is there and all XYZ, and the emotional part would be there. But where exactly did the immunity go low? Where exactly did the patient find that pinch? That's why the immunity had gone down. Ask that, and that's the entry point of your remedies. Otherwise we have remedies like we have basilinum, we have Teucrium marum verum, we have Nitromur, we have Sepia, we have Ignitia, we have Azadirachta indica for those symptoms. But it is important to understand where exactly did the immunity go low. No changes seen in her later, she said, after vaccination. Okay, so you go and see vaccination and then prescribe the remedy. Dr. Farsinusi, welcome. After, I think, at least a doctor, after a long time. Valerina Mendonica, welcome. Sir, in recent case of tube obstruction is cured with a medicine conception. Wow, very nice, Dr. Navjot, and congratulations to you. That's a fantastic, that's a fantastic example you have shared today, your case, because whenever you share results of cases where I could help you something in your practice, I'm very happy. And making and treating a case of infertility, the child, the family member will remember you for the whole life. So fantastic. One of the very important works of doctor you have done, and congratulations. And I hope you have many more results in your life and in your future. Just be very conscientious and diligent. Of course, every case you will not be able to cure, so no need to have that negative effect. But whatever case you get, diligently take the case, repetize, and I'm very happy that you have got the results. I think you need a big thumbs up from everybody, that she has conceived also. Thank you so much. Yeah, infertility case, every case now Navjot will come to you with lot of expectations, and when there is lot of expectations, automatically your what you call understanding of homeopathy, your understanding of the remedy should always be spot on, to get good results. Very nice. Good afternoon, Dr. Adlizi. Virin Trevadi joined. Thank you. So good afternoon. Thank you so much. So I hope you understood something about the hoarseness, because last time I had, and I think it was on my international webinar where I told that drinking water ameliorates, and in that also there is differentiation. Drinking cold water ameliorates in cupromet and causticum, but in my case it was just drinking water. So the remedy which I took was bromium. Asthma common remedies. See, one thing is very important, that asthma, there are so many remedies, doctor. There are so many remedies, and in asthma, make sure that you understand that in asthma you ask the question कि patient को हिंदी में बता रहा हूँ घुटन कब होती है. The patient is not able to express herself, express himself. Everything is dumping, and the patient start getting breathing difficulties. There are lots of remedies. You can write down remedies. You can think about sulfur, spongia, sambucus, kaliars, ipecac, calicarp, bupromed, blata orientalis, arsenic, argentum. At least ask me some question where you can ask me, sir, asthma aggravation in the morning, in the night, in the evening, so that I'll be able to tell you more, because there are so many. All remedies, all constitutional remedies basically can be given for asthma, depending on history. So that is very important. Otherwise, common remedies, blata and all are there. Ipecac is there, blata is there, intimidate is there, seneca is there, spongia, sulfur, stramonium, arsenic, calicarp, cuprum, kalias, pulsatilla. Lot of remedies are there. Naxomica. Family history asthma, nice. Natrum sulf, iodum, carcinosin, which I have seen in my practice. Patient 12 years, single paroxysm, dry cough throughout the day, but no cough during sleep. Used calcarea, drosera, but little amelioration. What next? This type of single paroxysm the whole day. Now ask something more, Dr. Paul. Ask something more. Where is the cough? How is the cough? How is the expectoration? It goes in the posterior nose. He has to always hawk. Sticky discharge comes out. Discharge comes out with very great difficulty. No problem. It is allergic. Then remedy changes. So define your case. Then we can get the remedy. Asthma with soupy expectoration with night aggravation, lean patient. Think about phosphorus. Think about Merxol. Think about syphilinum. Think about calcarea carb. Think about antim crude. So scope of homeopathy in low AMH level. What a fantastic question, Dr. Homeopathy. Very nice. In fact, last, I think 15 days before, a gynecologist had referred me. I think 3 months before, gynecologist referred. There is a gynecologist who have complete faith in homeopathy, and she keeps referring me patients, with low AMH. And I would say that maximum patients have got very good results with low AMH, and they are pregnant and they have conceived also, So homeopathy has a wonderful scope because there is no medicine in allopathy. So a complete case taking, especially in relation to emotions of the patient, is very, very important, Dr. Homeopathy. Fantastic question. Do take that case very diligently, and you'll be able to cure that case. Plantar fasciitis. Remedies, you can think about guaiacum, ledampal, ruta, rustox, nigudium, rare remedy, and Arenia diadana. Hyperacidity up to neck and head pain emulated by vomiting. Hyperacidity up to neck. See, head pain better by vomiting if you're telling a case of migraine or cluster headache or vascular headache, then it's a normal symptom of these type of headaches. So don't take that perception. Hyperacidity up to the neck. Normally, it happens in GERD, GERD. So it would definitely take a case. And just treating hyperacidity and there are no symptoms, then there are few remedies in homeopathy which are very very effective. You can write down the names. It is Robinia, Iris versicularis, second remedy. Third remedy you can think about. Now see, these remedies are my experience. It's not a guarantee, but these are very very important remedies which I have found very very useful in my practice. So you can start with Robinia, and Robinia will work, what do you call, very well. It's a organ specific remedy. So Robinia is there, Iris fir is there, sulfuric acid is there, phosphorus is there, kali carb is there, and then other remedies also. You can have China also, lycopodium also, carbo is also. But these are the important remedies which I have seen in my practice. Allergic cough, no expectoration. Yeah. So that means if there is no expectoration, the cough, how is the cough? It is absolutely dry. So whenever you have cough which is dry, we have two very well, rampant remedy है. Cough dry है, कुछ समझ में नहीं आ रहा. Think about think about Drosera, think about Spongia. Add to that list Rumex crispus, Hyoscyamus, Nux vomica, Calcarea, and China, and Alumina also. Patient starts from right side of lower jaw, extends to the ear, then temporal amelioration when she wears a cervical cuff. She used to touch her jaw repeatedly. So in this case, it's a simple case where the patient is suffering from cervical cord stenosis, and that's why the pain radiates from the lower jaw to the temple, and the patient repeatedly touches the lower jaw. Whenever I have found, this is not so guarantee, but whenever I have found that the pain in the lower jaw, spasms of the muscle, the patient touches the neck, first remedy you must think about is Simesifuga, Actia racemosa. Second remedy, Macphos. Third remedy, Rustox. Fourth remedy, Phosphorus. Fifth remedy, then Naxomic. Then there are a lot of remedies, but Simesifuga is the first remedy. Psoriasis occurring yearly once in August. That means you can say psoriasis occurring periodically, annually, in winters, aggravation. That is the case. In psoriasis, if you have seen my webinars, if you have joined my Google Meet or my webinar which I normally take, I have talked at length about psoriasis. You can go and watch my YouTube video. I have a lot of cured videos of psoriasis put on the YouTube. Lots of patient cured, but see, nowadays a lot of patient does not want to give their shooting because they don't want to see their video on the YouTube or Instagram, because before after it looks very odd. So a lot of cases, make sure that you take a good case, and this is the good symptom occurring annually. You can take that. Okay, Dr. Gulista, Dr. Lewis, Dr. Johnny, welcome. Okay, Dr. Navjot, yeah. So we have some time, because if I have joined late, I'll just push on for 10 minutes more. How to approach vitiligo. Now see, whenever you are approaching a case of vitiligo, and if you have read our organ of medicine, what does Hahnemann say? Anybody? What does Hahnemann say about our vitiligo? Which type of disease it is that? Anybody? Everybody knows that symptom. Everybody knows that. Which type of disease I am talking about? Anybody? There's a question from the audience. Case taking, we find so many difficulties. Yes. Vitiligo is a difficult one. Now, this is called Dr. What's your name? There's no name. Psychosomatic. No. Vitiligo basically is a one-sided disease. Vitiligo is a one-sided disease. You have to go to the organ of medicine, and if I am not wrong, it is aphorism number 172 to aphorism number 184. Hahnemann has described exactly what is one-sided disease. One-sided disease with affection of external kind, local malady. These are all. So go home and read one-sided disease, and you'll exactly come to know what to ask in case taking. Autoimmune. Yes. In recent case of viral fever, patients complained calf pain with swelling of ankle, finger pain, stiffness, pseudonym did not work. See, whenever there's a viral fever, as Hahnemann says about acute disease, every acute disease comes with some of the PQRS or identifying feature of the disease and of the patient also. Because any viral disease now will come with patient से बोलते ठंडी लग रही है, हाथ पैर में बहुत दुख रहा है, सर दुख रहा है, खाने का मन नहीं कर रहा है, तो हम लोग सब देंगे यूपिटोरियम पर्फ के सिम्टम. But the intensity of symptom, the thirst of Eupytoreum perf, the chill of Eupytoreum perf has to be there so that you can prescribe Eupytoreum perf later. I had a very interesting case. There are a lot of cases day in and day out for dengue. So I had a recent case where the platelet count was 20,000. He came after 5-6 days, and the doctor said that I had to admit that patient. But with our homeopathy medicine, just in 2 days, the platelet jumped from 20 to 50,000. There was the difference was not only that platelet count but the energy increased, which Hahnemann writes in the aphorism, in treating acute disease, the first thing to improve is the energy level of the patient has to increase, and that happened, and that's why we come to know that the medicine is working. So in viral disease, apart from Eupytoreum perf, you must think about simple remedies like arsenic album also, muriatic acid also, rustox also. So these remedies also work very well. Just try to differentiate the symptoms, and the gravity of symptom of all remedies is very important. The gravity, okay, that's important. Okay. So I hope yeah, Dr. Gulis, that is autoimmune disorders. Yes, it's autoimmune disorders, but our approach, autoimmune disorders, okay, in medicine it is written that, but our approach is what is written in organon by the master. That's why I told you one-sided disease. So if you go and read the aphorism 172 to 184, you will get the complete picture on how basically Hahnemann has wrote what is one-sided disease and how to approach a case taking. Every case taking was like that. Patient है आपके सामने और शुरू हो गया, नेचर कैसा है, क्या खाते, क्या पीते, क्या पसंद है. It is there, but one-sided disease, sometimes the approach is very important. Erosive enteral gastritis, right-sided inguinal hernia, plus high IgE plus dandruff. Vikram, if the Ig is high, if the dandruff is there, and erosive enteral gastritis, that means you're talking about patients who has gone from psychosis to SORA to psychosis and psychosyphilitic case because there is hernia also. In this case, I would only suggest one thing, that history taking is important. Erosive means there is a lot of destruction. So if there is destruction, ask why there is so much destruction. Also, you have written hernia, so there is psychosis, and high IgE, so allergic problem is there. In this case, see. Most of the cases I always discuss in my Google Meet when I take Google Meet, and every patient will pass through a state of suppression. Remember my words, everybody. I am maybe 45-50 years of age. So in this 50 years of my life, or 60 years of my life, or 70 years of my life, I would definitely have some suppression, because we are living in a society. We are not like libertinism. दिल खोल के जी रहे, कपड़े पहन रहे, नहीं पहन रहे, घूम रहे, जा रहे, आ रहे. Of course, there is freedom, but there is no libertinism, so that it is always in the society के दायरे में काम करना है. So everybody would pass through a stage of suppression once or twice or a lot of times in life. But whether that suppression has affected the constitution and that's why he's developed some symptom, that is very important. Otherwise, what happened that we go to the rubric elements from suppression and then we have remedies. Which are the remedies? Element from suppression. Anybody? There are some remedies which are very, very common. You can every time whenever you take a case, suppression comes, we first think about Cephalosporin, the most abused drug for suppression. Understand why that has created some difference in the constitution. That is very important. Otherwise, we have remedy like Cephalosporin, phosphoric acid, ignitia, natramur, chamomilla, lycopodium, colocin, all suppressive remedies. So make sure that whether that constitution has suffered because of suppression. Natramur, that is very important. So everybody passes through that stage of suppression. That's why make sure that the constitution has suffered from that. That's what I basically am teaching in the next month of Google Meet and the webinars. How to take a case, what symptom to take for interpretation, and then how to use the Mater Medica for your prescription, and then the results would be seen We'll show the results in before and after treatment of cases. We have all shooting cases also and paper cases also, where we'll show the result before and after. So that is important, what to take for prescription. I hope Dr. Vikram, you understood something about suppression. And there are different forms of suppression, because of respect, because of ego, because of family problem, because of money problem, because of career. Lot of things are there. It's a very deep thing. So if you can join and understand, I'll show you some cases of suppression where we have used that remedy and we have got results very fast, I think in a month's time also. Dr. Samnil Vijit, welcome. Dr. Ria, welcome. Okay, so I hope you understood something. If you understand, if you are getting my point, if you think that it is working, just give me a few thumbs up and 100% I think Instagram, so that I know that you are understanding what I'm speaking. Otherwise, I can keep on speaking and you don't understand. So it shouldn't happen like this. So thumbs up is very important. Motivation is very important. That's important for me also. Otherwise, I feel I am talking just to the screen, and there's no one-to-one talk. So I hope you understand something, and yeah, you can say, yeah, you can ask the query. Dilip Raut, welcome. You can ask the query first, doctor. Dr. Vans Rajesh. Yes? Yeah, so I am another. Yeah, please ask your query fast, so that it's already 36 minutes. So we are just through with the webinar, with the YouTube and Insta Live. My name, my God, you don't know my name also. If you can see my what you call pamphlet on Instagram or YouTube, you can get the name. Okay, Natramur Hura 30. I think we have discussed Hura before also. I think if you have seen my YouTube live, Dr. Abdequaem Chintana Grace Healing Homeopathy, I have discussed that Hura in my YouTube live. So if you can go and just see Hura in that, you will understand. I have discussed the case also. So in that case, you will be, I think Hura Brazilians is there, and there are a lot of other symptoms of Hura, and one of the main symptoms of Hura which you have to remember, I think I've done a case of skin symptoms, and I've told you something about that stiffness of neck, throbbing in the fingertips, and these are symptoms of Hura. And you go and see my YouTube live, and I've discussed Hura, the whole remedy, and it is very well described in the Allen's Encyclopedia. Very short is given in Boric Mater Medica, and it's given good in Clark Dictionary also. So I think you can go, and these are the symptoms which I think I discussed few webinars back, where I had discussed something about the symptoms of skin also, and Hura Brazilians, and skin symptom where it has very large pimples on cheek, which are very painful to touch, and clusters, red vesicles and pimples are there. Itching on the forehead is there. That was Hura case which I have discussed on skin symptoms. Okay, so I hope you understood, and I hope you liked what I taught. So we are getting late. I hope you join next my webinar, which is there on the month of November. Thank you for joining, and I hope you enjoyed as much as I enjoyed teaching you. Thank you so much. Thank you for joining.